Today we'll be discussing treatment options for a patient with hyperglycemia. This can be a scary diagnosis to some of your patients or most of your patients because it is life-changing. They will from now on have to monitor their diet, their lifestyle. They'll have to learn how to manage their stress, which can cause, if they don't, can cause obviously a boost in their blood sugars. The numbers that we are looking for is between 80 and 130 before meals, and less than 180 about 2 hours after those meals. So it's our job to educate these patients on diet, what they can have, what carbs they can have, which foods have sugars. A lot of times you can give them a food diary so they can write down what they are eating, how it's causing their blood sugars to rise, or if it's not at all. Some foods affect others worse. Also limiting alcohol, not smoking if they are. They need to come up with an exercise regimen, even if it's starting out slow. They don't have to jump right into the gym and kill themselves. 30 minutes of walking every day, breaking that up, just something to get them moving. How they are going to take their meds. Most providers start their patients off on metformin, which does come with side effects. A lot of patients experience diarrhea from metformin, which is obviously not something that they enjoy. So it's hard for them to stick to the regimen if it's something that they are getting negative, having a negative experience from. There are other oral meds, and then if their numbers are still not where they need to be, after an A1C, which is a 3-month average of their blood sugars, for a diabetic, we like that number to be less than 7. They will switch over to insulins. A lot of primary care providers do have educators for diabetes. Insulin can be a dangerous drug, and the patients do need to be educated on when to take their blood sugars, how much insulin they should be receiving. We want their diabetes controlled, but we don't want them to experience hypoglycemia, which is low blood sugars. So sitting with our patients, discussing these things with them, making sure that they understand it, giving them the handout so that they can take home. My Plate is a website that they can go to that also gives them a better idea and a colored picture of what their plate might look like while on a diet, following a diabetic diet. All of these things are very important in managing their diabetes. And we will go into depth further as to what diabetes does affect, the signs and symptoms, in the next few videos.